Hello, my name is Teresa Johnson, and this is my NR 509 physical exam. I do not have any assistive aids or any notes with me. This is my patient, Sheldon Johnson.
Yes, my name is Sheldon Johnson. I give Teresa Johnson permission to film me for Chamberlain University.
And I have a recorder in the room, and she's going to scan the room for me. Now, I will start by inspecting his face. I do not see any discoloration or any lesions. His head is midline and symmetric. And I will go ahead and start palpating his lymph nodes. In the front of his ear is the preauricular lymph nodes. Behind his ear is the postauricular lymph nodes. Behind his head at the occipital is the occipital lymph nodes. Move forward to the tonsillar lymph nodes. Move forward to the submandibular right under the jaw lymph nodes. And then his submental lymph nodes. We have his anterior cervical lymph nodes, his posterior cervical lymph nodes, and then his supraclavicular lymph nodes. I will now move to assess cranial nerve number 5, which is a trigeminal nerve. It has both a sensory and motory component. I'm going to palpate his masseter muscle here, and I'm going to have you clench your jaw, and it's good strength bilaterally. Now I'm going to test the sensory component of the trigeminal nerve number 5. I'm going to have you close your eyes, and then let me know where you feel my touch.
Forehead, nose, right cheek, left cheek, chin.
Good. Now I'm going to test cranial nerve number 7, which is his facial nerve. I'm going to have you take a nice smile for me, and it is symmetric. I'm going to have you blow out your cheeks like a blowfish. Good. Now I'm going to have you pucker your lips. Good. I'm going to have you raise your eyebrows. Good. And cranial nerve number 7 is intact. Now I'm going to move to his ears, and I see that his ears are symmetric, and I will go ahead and inspect his ears. And I'm looking at his ears, and I see that there is no drainage, no redness, any external auditory canal. I do not see any cerumen. It looks clear, no effusions in the middle part of the ear. The tympanic membrane looks pearly gray. Pulling the pinna up and back again. His external auditory canal is nice and clear. I do not see any redness, any drainage. Middle part of his ear with no evidence of effusion. No cerumen. Looks good. Now we'll test his cranial nerve number 8, which is the acoustic nerve. I will have Mr. Johnson cover one ear, and I will whisper 3 words into one ear, and he will repeat it.
1, 2, 3.
Good. Cover your other ear.
1, 2, 3.
Okay. His cranial nerve number 8 is intact. Now I will move to look at his eyes. And looking at his eyes, I'll look at the conjunctiva of his eyes, and they look nice pink. No redness or drainage. The sclera of his eyes are nice and clear and white. Okay. Okay. I will test optic. I'm sorry. What I'm going to do first is test optic nerve number 2, and with the Stellan chart. Yes, cranial nerve number 2, which is the optic nerve, and now stand 6 feet away, and have Mr. Johnson read the lowest line possible.
Okay.
Cover one eye. Cover your left eye.
Okay. DHJBS.
Okay. Cover your right eye.
CFDHJ.
Okay. And then with both eyes.
CRDH. RDHJ.
Okay, thank you. And Mr. Johnson in his left eye has 20/40, and with his left eye he has 20/25, and with both hands over his eyes he has 20/25 as well. Okay, now I will still stay on optic nerve number 2 and test his pupillary response. And I will have you look straight ahead at me. Look straight ahead at me.
Okay.
And he has good pupillary response. They're equal and reactive to light, and it's about a 2 millimeters. Okay, I will still continue with ocular motor number 2, and then test his peripheral vision. You want to stand up for me? This side. Okay. Let me know when you see my hands.
Now.
Okay. Let me know when you see my hands.
Now.
Okay. Let me know when you see my hands.
Now.
You can have a seat. Okay. Next, I will test the ocular motor nerve, which is cranial nerve number 3. I will test the trochlear nerve, which is cranial nerve number 4. And I will test the abducens nerve, which is cranial nerve number 6. And together these do the extraocular movements, and I will form an H, and Mr. Johnson will follow my hand. Okay. And ocular motors 3, 4, I'm sorry, cranial nerves 3, 4, and 6 are intact. All extraocular movements are normal. Next, I will go ahead and assess, look at his nose, and you notice his nose is nice and midline. I don't see any deviations or any fractures or anything. Okay, and so now I will look at his left turbinate. And I notice that his turbinates are nice and pink, no bogginess. His septum is nice and straight, no deviations there. The same for his right turbinate, nice and pink and moist, no deviations with his septum, is nice and straight. Next, I will palpate his sinuses, and let me know if you feel any pain.
No.
There.
Nope.
Okay, what about right here, your maxillary?
No.
Okay, good. All right, and that is normal. Next, I will go ahead and look at Mr. Johnson's mouth. Looking at his mouth, I see that they are darkly pigmented. Close your mouth. They're darkly pigmented. Lips are nice and moist. They're not dry. You can now open your mouth. Okay. All right. Looking at his teeth, they are. I don't notice any cavities. Gums are nice and pink. Right and left buccal mucosa are nice and pink. Tongue is nice and pink and smooth. His hard palate is nice and pink, no lesions. Lift your tongue up for me, please. I don't see any lesions under his tongue. Okay. Okay. Now I'm going to test the vagus nerve number 10, and this is I'm gonna have him go and see if his uvula raises with phonation. Stick your tongue out. Okay. I don't see any tonsils, by the way. Can you say ah?
Ah.
Okay, and his uvula raises with phonation. Okay. Okay. Can you stick your tongue out and move it from left to right? That is cranial nerve number 12, the hypoglossal, and that is intact. Now I'm going to test his TMJ, which is tubular mandibular joint. I'm going to palpate his tubular mandibular joint right here. I'm going to have you open your mouth and close it. I do not feel any crepitus, any tenderness there, or any subluxation. Do you have any tenderness?
No.
And no subluxation. I can't even talk, subluxation. There. Okay. Next, I'm going to assess his neck. Looking at his neck looks nice and straight in midline. I'm going to palpate his trachea. It's nice and straight. Okay. I'm going to palpate his thyroid, finding his Finding my landmarks right here. The cricoid process, the cricoid and the suprasternal notch. And I'm gonna go in between here, which will be my landmark. I'll pull one side over, and I'll palpate while he swallows. And his thyroid rises with the swallow. I'll pull the other side of it, and palpate as he swallows again the thyroid. And it does rise with his swallow. Next, I'll palpate the carotid artery. Okay. Okay, and there's 2 plus on both sides. All right. Next, I'll go ahead and auscultate his carotids. And I will say that I do not have a bell on my stethoscope. But I'm gonna ordinarily I will auscultate for bruits with the bell of my stethoscope. But I'll use a diaphragm. I'm gonna have Mr. Johnson take a breath and hold it. Good. Take a deep breath and hold it. Good. And I did not notice any bruits there. Okay. Next, I'm going to have Mr. Johnson do range of motion with his neck. Mr. Johnson, can you put your neck, move your neck forward to your chest? That is flexion. Move your head up. Okay, back. Okay, that is extension. Move your head to the left, laterally to your left. Have your head touch your shoulder. Okay. Now to the right. Okay, turn your head over, look over your right shoulder. Look over your left shoulder. Okay, he has good range of motion there. Next, I'll test the accessory nerve, which is cranial nerve number 11, by putting my hands on his shoulders with some resistance, and asking Mr. Johnson to shrug his shoulders. Good, good strength there. Okay, great. Next, I'll go ahead and auscultate Mr. Johnson's heart sounds. Again, we will ordinarily auscultate with both the bell and the diaphragm, but I only have the diaphragm. So I'll start at the second intercostal space, and that is to the right of the sternal border, and that is the aortic area. To the left of the left of the sternal border, second intercostal space is the pulmonic area. Third intercostal space is Erb's point, the left of the sternal border. Fourth intercostal space to the left of the sternal border is the tricuspid area. And the fifth intercostal space at the midclavicular is the mitral area. Next, I will auscultate his anterior lung sounds, and I will start at the intercostal spaces. Take a deep breath. Hold it. Let it out. Breathe normally. Breathe normally. Yep. Good. There are no adventitious breath sounds as lung sounds sound clear. Can you stand up and now auscultate your posterior chest? Okay. Take a deep breath in and breathe normally. Auscultating his right middle lobe. Thank you very much. And again, no adventitious breath sounds. Lungs sound nice and clear. Okay. Next, I will check I will test the range of motion of his elbow. This is flexion, and this is extension for his elbow. Next, I will test the deep tendon reflexes. Good response there. Next, I will test his patella. Good response. And then next, I will test his Achilles. I will have him relax his foot. Just relax. I'm going to dorsiflex it a little teeny bit. And then I'm gonna hit your Achilles. Good. Good response there. Okay. Next, I will test the range of motion of his shoulders. Okay. So this is flexion. Bench flexion a little bit. This is extension. This is internal rotation. This is external rotation. Okay. This is abduction. This is adduction. And he has good range of motion there. Next, I'm going to have Mr. Johnson lay down on the bed, and I'll go ahead and auscultate his breath sounds. I'm sorry, his bowel sounds. Mr. Johnson, can you move a little bit closer to me? Good. And I'll raise your stroke here a little bit. Great. Okay. He has good bowel sounds, normal active in all 4 quadrants. Next, I'll come below the xiphoid process and auscultate the aorta. Okay. To the right of the umbilicus, I'll auscultate the right renal artery above the umbilicus to the right. Above the umbilicus to the left is the left renal artery. Below the umbilicus to the left is the left iliac artery. And below the umbilicus to the right is the right iliac artery. And again, I'm listening for bruits, and you will ordinarily listen for bruits with the Belanger stethoscope, but it's not. We do not have that. Next, I will go ahead and percuss all 4 quadrants for tympany, flatness, and dullness. And it sounds good. I don't hear any of that. Next, I'll go ahead and palpate all 4 areas, right, left, and upper quadrants of his abdomen for any masses. I don't feel or see any masses. Contour is good. Don't see any masses or anything like that. Next, I'll go ahead and palpate for his liver. I'll put my hand behind his back and put my left hand behind his back. Put my right hand near the costovertebral angle, and I'll have Mr. Johnson take a deep breath. And I'm palpating for his liver. I do not feel it. Good. I'll do the same for this one over here. Okay, my hand is behind his back. My right hand is behind his back. I'll have him take a deep breath, and I'll palpate in. Right, the clavicular and up. And I do not feel his spleen. So his liver and spleen are not palpable. Next, I'm gonna, okay, I think that's good. So, yeah, so now I'm gonna go ahead and do the range of motion for your legs. So I'm going to flex your leg up first and flex it back down, and I'll bring it out for abduction, adduction, okay, and then we'll do flexion and extension. Okay, all right. I am looking at Mr. Johnson's legs, and I don't see any broken skin. His skin is intact. I don't see any swelling. Everything looks good and intact. I'm now going to test his range of motion for his ankle. And I'm going to hold your ankle up, and we're going to do dorsiflex, and we're going to do plantar flex, and then we're going to do a rotation. And he has good range of motion in his ankles. I'm going to ask you to push your legs up. All right. And I'm going to have you push against my hands, strength. Okay. And pull back, resist. Good. All right. Put your legs flat again. I'm going to have you push against my hands. Good. All right. Checking his dorsalis pedis arteries. Good. 2+. All right. Now I'm going to have you sit up. Okay. Now I'm going to have you squeeze my hands for your strength there. Good. I'm going to have you do the serial digits where you take your thumb and you go like this and then go faster. All right, good. All right, I'm going to have you put your hands right here and do this and do this and go faster. Okay, good. Now I'm going to check his capillary refill, and you press it down until it turns white. I release it, and it's 3 seconds capillary refill, which is a normal finding. I'm going to do this with this one until it turns white. Release, and 3 capillary refill occurred in less than 3 seconds. Okay, I'm going to test this. Pulses, bilateral pulses are good, 2+. And again, his strength in his hands, when he squeezed my hands, were 5 out of 5. I'm going to test his bicep and tricep strength. We're going to have you flex your arm. Okay, push against my hand. Good. Pull back. Wonderful. Good. And I'm going to have you lay back down. Do something. One thing that I need to do is test his the Bloomberg, where we go mid-clavicular and go down at a 90-degree angle. And we go in at a 90-degree angle. When I release, if he has any pain, any tenderness, he will let me know. Okay.
No.
Mid-clavicular on this side as well?
No.
No. Do you have any tenderness when I release?
No.
Okay. Thank you. And you can sit up. Okay. Now I'm going to have you stand up. And I'm going to have you close your eyes. And this is the Romberg sign. We're testing balance for 20 seconds. Okay, and his Romberg sign is negative. You can open your eyes. Now I'm going to test his the range of motion of his back. Can you bend down and touch your toes? Good. Can you go back? Good. Can you lean to your left? Good. Can you go to your right as far as you can go? Good. Can you turn to your right rotation? And can you do a left rotation? Wonderful. Can you turn around? All right, I'm going to check his spine. I don't notice any deformities. His spine is nice and straight. No curvatures. Any pain or tenderness, Mr. Johnson?
No.
Okay. All right, good. All right, can you turn around and walk towards me? Good. And turn around and walk back. Assessing his gait, and he has good gait. All right. And I think this concludes my physical exam for NR 509. Thank you.